Day 18th, almost the end. Tomorrow will be 1 month, and I just got home. It is 6 o'clock, and my infusion started at 10 o'clock sharp. And I want to sort of delve into things that I haven't been able to about ketamine. Once you pass, like, say, 240, little details of being able to take care of home chores become very difficult, and feeding the dogs and cleaning up after them, taking the trash out, doing laundry. I did experience extreme nausea over the weekend and was throwing up all weekend, couldn't get out of bed. So, laundry's piled up. Scott had to do the laundry, bless his heart. And he fed the dogs today. They get fed at 4, and they have an internal little clock in their tummies, and they want their food at 4. And he's on the road coming to pick me up, battling traffic. It takes about 2 hours in traffic at the 4 o'clock hour. But I wanted to give rave reviews. What I didn't know, I had not seen a doctor. And what I found out today, that I did get a doctor, and that he had been coming in to check in on me once I hit the 240 mark of ketamine. It's a much different story getting booster shots and then having a Piccline for 2 months straight. It's really intense, and the only hospital that I know personally that's doing the 2 month with the Piccline and letting you go home at night and coming back early in the morning is USC Keck in Los Angeles, California. Stanford is a very fine hospital. I was there for my scleroderma, which is another autoimmune disease that I have, on top of being a cancer survivor. And, the TMJ and the trigeminal neuralgia and frozen shoulder from my cancer. The ABCs, alphabet, the list, the litany of side disorders that I have, that ketamine may help or may not help. The bulging disc, they will not help. So I will live with that pain. It's too high up really to have surgery. I'll be a quadriplegic if they go in at the C2 level. My dogs are playing. Had a better experience today because I said no Benadryl. Benadryl they put into my IV, and if I take a Benadryl pill, I am knocked out for 2 days. I have really bad allergies, so I'm familiar with Benadryl pills, but slamming it into the IV was making me not be able to be lucid for hours once I got home. My dogs demanding attention. They need to have their mama clean up after them and play with them, and I was unable to. And it was the Benadryl. So, I get the Versed, the magnesium, the anti-nausea medicine, the clonidine, I had a really bad headache today. I felt like someone was hitting me with a pickaxe in my brain. They rushed in because I was pushing the button, help me, help me, help me. And they immediately put Imitrex into my IV, and that helped. I do not have a headache now, but it was terrible. So nausea and also night sweats, but you get them in the day, like you're going through menopause. Hey girls, say hi. Okay. So a lot of nausea, a lot of headaches when you're going through 2 months. I do plan on delving into booster shots in the future, which will be anywhere from 3 days to 2 weeks. Preferably just go in for 3 days in a row and just keep that booster of ketamine going through my system, and taking the pills, which I'm not taking right now, but I was taking for 2 months prior to treatment to start getting ketamine into my system. So I'm trying to cover as many subjects as I can. I'm still under the effects. But you have a cup of coffee and you snap out of it. There's been a few comments like, oh, Jennifer's so out of it. She shouldn't be making videos, but I want the true story. This is the real, what's going on. The good, the bad, the funny, the side effects, when I'm completely out of it. I will post all of them. I was unable to get photos of me going, ooh. I called my mom. I just said, Siri, call mom. I needed my mother. I just needed to hear her voice. And I was crying again through treatments from the headaches and on. And subconsciously, anything that's in your mind that you're able to normally push out, hurtful things maybe a friend said or anything, come out in your vivid dreams. And so I was wanting my mama, and I called her, and in the middle of really being out of it. We'll have a laugh over that, I'm sure. But we take her to the doctor. Scott does, again, bless his heart. He takes her to my pain specialist. She was diagnosed with CRPS a year ago. I noticed her symptoms and knew right away when she had to fall into the bathtub a year and a half ago, actually, that 6 months into it, I realized she has CRPS. So there is a gene that they are finding out that more and more family members are getting CRPS, are predisposed to getting it if they get an injury. So this is a long one. I'm trying to get everything out there. I've had a few people message me to not stop the videos and to keep them going. A few other people have said, oh, you shouldn't be putting them out there. You're kind of out of your mind loopy, and you shouldn't do them. But no one will really know the true journey of ketamine if I don't do this, and I encourage everyone going through ketamine to do this. Over and out, and tomorrow is my last day for 1 month, and then I'll have 4 days off, and then I start into week 5 for 2 months total. I get a new Piccline beginning of 5th week. They only let the Piccline stay in for 1 month. And they're pretty gnarly. I've had 13 of them in my life. So, you can't really see it, but it's a bloody, icky mess. Piccline is peripherally inserted central line that goes into the heart. I'm mid, so it's about here instead of here. Goes from here, it's about here. Usually they go right into behind the heart. That's what Piccline, peripherally inserted central catheter. Okay, bye-bye. I'm doing my best. Ciao.